Alright guys and girls, it's Jerningham here. There were 71 deaths in the UK of coronavirus yesterday. So basically it went up. Today, the deaths are even worse. It's the same as yesterday. So in my opinion, that's not very good. So, yeah, so basically it's the same deaths today. So we're going to be playing Boris Johnson's video. And we're going to be seeing the same amount of deaths today. 500. So we're going to be doing it again. The phone crashed, so I do forgive me on this, guys and girls, if you wanted to watch this, and I've taken the other video down because it's no point watching half a video and it doesn't work, or something like that, if that makes any sense. Anyway, we're going to be playing the video, and we're going to be trying to understand the video where this virus is going.
Good afternoon. When I spoke to you all last week, I explained that the number of COVID patients going into hospital had doubled in a fortnight, and I explained that the rate of infections...
Why is the phone blurry?
I said that we face the sad reality that on these figures we could expect many more daily deaths. And so that's why we announced a package of restrictions and stronger enforcement last week. At the same time, we've been intensifying the local lockdowns in areas where the disease has been flaring up. And I want to say, I know how tough it is and has been for these communities. And I want to pay a particular tribute to the students who are experiencing a first term back at university, unlike anything they could have imagined. I can assure you and assure everybody at universities that plans are being put in place to allow students home safely for Christmas. And I wish I could tell you tonight that the impact of this package has already begun to appear, but it will take time to feed through. And yesterday we saw the biggest rise in daily cases since the pandemic began. Today, a further 7,108. We've also had a tragic increase in the number of daily deaths, with 71 yesterday and again today. And these figures show why our plan is so essential. We have to stick to it together, and we should stick to it with confidence, because there are many ways in which we're far better prepared than we were in March. We're on track to hit our target of being able to conduct 500,000 tests a day by the end of October. We're already exceeding the number of tests per capita that are conducted in Germany, France and Spain. We have over 2,000 beds that could be available across seven Nightingale hospitals, and we will be able to go further if needed. We've ordered 32 billion items of PPE, and we'll have a 4-month stockpile of masks, visors, gowns and other essentials for winter. By December, by the way, we expect UK manufacturers will meet 70% of the demand for PPE, compared with just 1% before the pandemic. And in the last 6 months, we've more than trebled the availability of mechanical ventilators to our NHS across the UK to 31,500. But the best way forwards to protect the NHS, save lives, to keep our children in school and the economy moving, is to follow the rules wherever we live. So I want to thank everyone for the fantastic national effort that we are seeing and continuing to see. And no matter how impatient we may be, how fed up we may become, there is only one way of doing this, and that's by showing a collective forbearance, common sense, and willingness to make sacrifices for the safety of others. At this critical moment, when I know people will be wanting to know the details, I will be providing regular updates through these press conferences. And I have to be clear that if the evidence requires it, we will not hesitate to take further measures that would, I'm afraid, be more costly than the ones we put into effect now. But if we put in the work together now, then we give ourselves the best possible chance of avoiding that outcome and avoiding further measures. I know that some people will think we should give up and let the virus take its course, despite the huge loss of life that that would potentially entail. I have to say, I profoundly disagree. And I don't think it's what the British people want. I don't think they want to throw in the sponge. They want to fight and defeat this virus. And that is what we're going to do. Even as we fight COVID, it's vital that people get all the treatment they need for other conditions. But it must be clear, if the NHS were to be overwhelmed by COVID, then no one could get any such care. And that's why we must bear down on this virus now, so that we never reach that point. And I'm absolutely confident that with ever increased testing, with better treatments, and of course with the prospect of a vaccine, we will get through this. So let's follow the rules, wash our hands, cover our faces, observe social distancing, download the app, as 14 million of you have already done, and together we will fight back against this virus, protect our NHS, and save many more lives. I'm now going to hand over to Chris Whitty.
Thank you, Prime Minister. First slide, please. I thought it was sensible to start off looking back over what happened in the first wave of this pandemic in the UK. And these are the Office for National Statistics data, the ONS data, showing all-cause mortality, which is the most important thing to look at, because it includes both the direct deaths from COVID in the red line, but also the indirect deaths, which are the excess deaths over the yearly average from all causes, because as we know, and it's been discussed many times in these meetings, you can have people who die because the health service is overwhelmed, or because the health service is less able to operate effectively, or in the long run, because of the economic impacts of the interventions we have. So all-cause mortality is critical. And if you look at this across the various areas of England, and the same is true, in fact, if you look in the other three nations of the United Kingdom, what you see is a wave that happened over the period from late March through to July in all-cause and COVID-associated mortality. And these data are broken down by region. Next slide, please. The pattern we are seeing in the current upswing in COVID cases is at this point in time, and this may change, rather different. There is, on the left, what we have is the total rate in terms of the amount of COVID that is being detected on a weekly basis, where darker colours are the more severe, the higher rates. And as you can see at this point in time, there is a very heavy concentration in particular areas, in particular in the northwest, the northeast, and parts of the Midlands. But on the right, what you can see is also the increase in COVID activity that is happening over the last 7 days. Any colour in orange means it is increasing, and the darker the colour, the more rapid the increase. So what you can see in this is that there's a general increase across the whole of England, and the same is also true in Scotland, Wales and Northern Ireland, with a few exceptions, but a very rapid increase in particular areas, again, particularly in the northeast, northwest, and areas of the Midlands, not exclusively there. Next slide, please. And this breaks this down into the regions of England, but also looking at different age groups. And what you can see in each of these areas is the multiple age bands from the dark blue, which are the youngest children, up to the black, which is those aged 80 or over. And in most regions of England, you're seeing a relatively flat, though gradually rising picture in terms of number of COVID cases over time. But if you look at the northeast and northwest and Yorkshire and Humber, and to a lesser extent the West Midlands, you can see a significant rise now, particularly in younger people, but increasingly also in people who are older and have a greater risk of having a bad outcome. Remembering, of course, that young people can also have bad outcomes in terms of prolonged symptoms, even if they do not have a fatal case or one that gets them intensive care. So this increase, as you can see, is accelerating quite rapidly in some of those areas. Next slide, please. Some people are worried that this might be based just on testing capacity. So this is a different way of looking at the same thing in the same areas, looking at test positivity rate. And in parts, in particular, of the northeast and the northwest, we've moved from a situation where, by age group, the average might have less than 5% of tests being positive, up to a situation where, for some age groups, over 15% of tests are now positive. This implies there is a very significant increase in terms of transmission in these areas. Again, quite variable across the country. Next slide, please. It's important to differentiate between different age bands, between younger people, children, and young adults. And this is just to make the point. In the dark blue and light blue colours, we have children 5 to 10 and 11 to 14, and in green we have children aged 15 to 16. And in these groups, currently, the rates are actually really not changing very much. These are school-age children in the main. Whereas in older young children and young adults, in those 17 up to 21, and the same is true for other young adults, the rates are now going quite rapidly. I've chosen to illustrate it with slide positivity. I could have done this with other routes. So this is important to remember when people worry about schooling. Schools are one of the areas, school-age children is one of the areas where the rates are not going up. And this is true across the country. Next slide, please. There is, I think, some people are wondering whether we could actually have a situation where the rates of infections are going up, but we're not seeing increases in hospitalisation. So what this has on this slide is the admission rates on the right to hospital and the intensive care rates on the left by age. And I think an important thing to see on this is that the dark blue, dark line at the top and the green line, which is the one below that, in terms of people being hospitalised, are those 85 and over and 75 to 84. So older people are getting this, and they are then having to go into hospital and then transferring some of them, sadly, into intensive care. Next slide, please. And if we look at the hospitalisations across the country, they follow very much the pattern you would expect from the rates of infection. So in the northwest and the northeast and Yorkshire, the NHS data show that the rates of hospitalisation are now climbing steadily. They're at a much lower level than they were at the beginning of April. I want to stress that really clearly, but they are definitely heading upward at a now relatively steady and rapid pace. In other areas, this is rather slower, and London and the Midlands are between these areas. Next slide, please. Final slide is just to look again at the intensive care rates, and people who enter intensive care are at significantly increased risk of dying. And this is again just showing in the northeast, and in the northwest in particular, but also in London to some extent, we're seeing a significant uptick in the number of people who are entering intensive care. This is not yet at a stage where it is threatening our ability to have intensive care cases. There's still significant capacity in the NHS system, but this is definitely heading the wrong way. The final point I'd like to make before we go on to just an animation looking at the spread over time is about those who do not have COVID, and it is something which my colleagues in the medical profession have asked me to stress really strongly to people this evening. And that is that the NHS is absolutely open for business, and it is absolutely there, not just for emergencies, for cancer care and for all other kinds of care. So what we're not saying is please don't go to hospital, please don't go to your GP, absolutely not. We definitely are very, very keen as a profession, as well as within government, that that continues. But we are just pointing out that the direction of travel for both hospitals and intensive care is clearly going in the wrong direction, particularly in these areas which have seen rapid increases in cases. We now have an animation. So this shows a map over time, starting in March. Lighter colours are small amounts of COVID. This is how it spread in the first wave. On the right, you can see the wave getting steadily darker, concentrating at that stage in particular around London, but also other areas of the Midlands, North and elsewhere. And then due to the remarkable efforts of the entire nation, everybody coming together, we got on top of that wave. People kept social distancing, they kept to all the rules about hands, face and space, and we had significant things that led to people not coming together in households. And the amount of COVID went down over time, but then it started to come back again, concentrating initially in a small number of places, but then has steadily spread, initially in these areas in the North and Midlands, primarily, not exclusively, but now potentially spreading elsewhere if we do not all take all of the various issues about social distancing and hands, face and space very seriously. Thank you very much.
Thanks very much, Chris. And I think that point about the NHS and the capacity of the NHS and the openness of the NHS to people to go and have their issues dealt with is very, very important. But obviously that becomes much less possible if we get an increased spike in the disease across the country. Let's go to questions from the public first. To Tia from Oldham.
That the appropriate support is available across the UK for young people to be able to fulfil their potential moving through these times of uncertainty, as lockdown and COVID-19 have affected young people's mental health, education and youth unemployment has risen.
Well, thank you very much, Tia. I think the answer to that is obviously that we will do everything we can to help young people through this difficult time, and you'll have seen the package that we put in place to support people going back to universities, working with the Vice Chancellors to get COVID-secure universities. And again, I thank students for the responsible way that they are behaving. In terms of employment for young people, Tia, the answer is that we really want to help young people get into jobs wherever we possibly can. That's why we've launched the Kickstart plan, £2 billion Kickstart plan to give people support in jobs, give employers support from the government up to the value of the living wage to support young people into work. And I'd also mention what we're doing in terms of training, the lifetime skills guarantee that we announced yesterday to give young people in their 20s, the ability to retrain, get the jobs that are out there. And we will do everything we can, as I've said repeatedly, to put our arms around the workforce, help young people through this pandemic, and bounce back as strongly as we can the other side.
I'm Chris Wallace of Fox News, and I welcome you to the first of the 2020 presidential debates between President Donald J. Trump and former Vice President Joe Biden. This debate is sponsored by the Commission on Presidential Debates. The Commission has designed the format, 6 roughly 50.
If you've all enjoyed the video, give it a like, give it a comment, share it with your friends. I'll see you in the next one. Peace.